Sri Lanka's vaccination program has seen rapid acceleration in the past week. The president instructed the health authorities to vaccinate all persons above the age of 30 in the Western Province by the end of the month and to immunize the same age group outside the Western Province by September. Given the size of the task, it is just as well that the daily vaccination record was broken 3 days in a row this week, with the highest of 384,763 coming on Wednesday. The walk-in vaccinations have clearly played a part in the high daily vaccination numbers, with the move seeing a great degree of interest from the people. The efficiency with which those centres are operated by Triforce personnel have drawn praise from the people. As per the instructions of President Gotabaya Rajapaksa, officials also took measures to conduct mobile vaccination services for members of the public who are unable to leave their homes due to illnesses. As such, officials at the Piliyandala Medical Office of Health began the program today. Meanwhile, yesterday health authorities were able to inoculate 244,706 persons with the AstraZeneca, Sinopharm and Pfizer vaccines. By last evening, 5,404,938 persons had been given the first dose of any COVID jab approved for emergency use in the island. From that, 1,646,176 people have received both doses, meaning they are now fully vaccinated. In the meantime, it has been a well-known fact that a majority of COVID-19 related fatalities reported across the world have been among persons who are immunocompromised. This encompasses persons suffering from underlying health conditions such as heart disease, cancer as well as organ diseases. Also among them is diabetes, and the World Health Organization says that some don't even know that they have the illness, which puts them in harm's way.
Diabetes has been increasingly common in the past 30 years, and there are now more than 400 million people living with diabetes in the world. Unfortunately, about 1/2 of them do not know they have diabetes, they have not been diagnosed. This pandemic has shown that people with diabetes are at higher risk than people without diabetes of having a severe illness, COVID, and also dying of COVID. The two main types of diabetes are type 1 and type 2. Type 2 is much more common. Type 1 seems to also have a higher risk than type 2 of a severe COVID illness and death.
The WHO is of the view that diabetes patients should somehow find ways to stay active amid the pandemic-induced restrictions.
The pandemic and the measures to contain it are quite a challenge for people with diabetes. The mainstone in treatment is physical activity and a healthy diet, and that might not be possible in the pandemic conditions. The people with diabetes have to be creative about how to manage to continue the recommended physical activity and a healthy diet within the constraints posed by the pandemic.
The warning from the WHO as well as from local health authorities is that the pandemic is far from over despite varying levels of vaccination success. In Sri Lanka, that is very much true. The number of new infections confirmed yesterday was 1,517. The Western Province reported the highest with 637 cases. District-wise, 2 of the 3 districts of the Western Province, Colombo and Gampar, topped the list with 252 and 232 infections respectively. 71 imported cases were also reported yesterday from COVID treatment centres. As for today, 980 new cases of the novel coronavirus have been confirmed so far. Meanwhile, the country's recoveries rose by 962 today, taking the overall number of persons to have recovered from the virus to 255,833. In other developments, Chief of the National Operations Centre for the Prevention of COVID-19, Army Commander General Shavendra Silva announced that several areas in 4 districts have been brought out of isolation. As such, the Madayava village in the Kegol district, the upper division of Matuagalavatta in the Ratnapura district, and the Maruttamunai 3 Gramanildara division in the Ampara district were brought out of isolation today. The areas of Vihara Lane, Vihara Mavata and Karappa Church Road and the Velamada Paragama area in the Suduhumpala West and East Gramanildara divisions in the Kandy district too were freed from isolation.
ලීව ආයුෂ් කහ සබන් සඳක් වගේ බබලන පිවිතුරු සමකට